My name is Pete Conrad. I'm the CAST Fellowship Program Director for the Stereotactic and Functional Neurosurgery program here at the Rockefeller Neuroscience Institute here at West Virginia University. And I want to tell people a little bit about the types of opportunities we have to offer trainees who are interested in getting extra training in stereotactic and functional neurosurgery. So in our general view, first of all, the program is busy, robust. We have international leaders here at our institution. Dr. Rezai, being the director over the Rockefeller Institute, is a world authority on neuromodulation and new types of therapy, not just deep brain stimulation for different indications, but we're pioneering the use of focused ultrasound and blood-brain barrier disruption to help people with Alzheimer's, for instance, and opioid use disorders. I came here last fall and had been pretty busy leading a national program on deep brain stimulation surgery. My background personally is also a bioengineer, and I love devices, and I love teaching people about the engineering principles and the physiology behind devices. And then Dr. Nick Brandmeier is also on faculty here as our third functional neurosurgeon and does a lot of epilepsy surgery, plus supports the programs for pain management, cancer pain, and of course the movement disorders program. And we also have a radiosurgery program with Dr. Cifarelli, in which we also are able to use the radiosurgery unit for treatment of trigeminal neuralgia, for instance. So functional neurosurgery in general, in the traditional sense, is three things that we try and teach our fellows. One is movement disorders, which is not just Parkinson's and central tremor, but also the management of the entire motor system problems like spasticity. So we have an active pump spasticity program here. It's epilepsy surgery, which is basically understanding the fundamentals of circuit disorders of the brain. And that includes the whole gamut of resections to implants and laser therapy for epilepsy. And then pain management, which is very broad and comprehensive. It's not just about chronic pain situations like back pain or peripheral neuropathy, which we do a lot of those for with spinal cord stim and peripheral nerve implants, but cancer pain management is growing here. We have active involvement with the cancer program to help palliate severe types of cancer pain that aren't responding to medicines. It's also trigeminal neuralgia. We have a very large increasing trigeminal neuralgia program here, and options including open microvascular decompression, balloon rhizotomies, RFLs, those sorts of procedures, and then of course radiosurgery is another option. Those are sort of the traditional things: movement, epilepsy, and pain. And then of course we're actively involved in a lot of research protocols for Alzheimer's disease and cognitive disorders, substance abuse disorders. These are sort of the forefronts of where functional neurosurgery will be going. And a lot of those studies are NIH funded here. There's opportunities for the fellows to learn about research, conducting clinical trials. This program is very interested in training our next generation of academic functional neurosurgeons. I have a real personal mission to mentor and teach young faculty about the process of getting NIH awards, doing clinical trials, and how to think about trans-institutional studies. If you come here, you will get a lot of that and plus some. And then not to mention the fact that several of us are continuing to lead a lot of national societies, so you have opportunities to get exposure at a national level to our colleagues. So we hope to see you. Please inquire about the program, and would love to look at your resume and talk to you more about our fellowship.